Hi, my name is Sophie Blakemore and I'm Assistant Editor of RCN Publishing's Specialist Nursing Journals. RCN Publishing has a suite of journals including Nursing Standard and a range of specialist titles covering various nursing practice areas. These can be seen on the RCN Publishing website. The journals publish a range of articles including literature reviews, new research, clinical practice and innovations. There are several reasons why you might want to consider writing an article for publication in one of RCN Publishing's journals. The first of these is to share evidence. You may have introduced a practice innovation or carried out some research that you want to share with your peers because you feel it might benefit their practice and improve patient care. Sharing your work in this way can help others to improve their practice in areas outside of your own work environment. You may be expected to disseminate good practice by senior managers who see it as an opportunity to raise the profile of your workplace. Or you might feel particularly strongly about a certain topic, health policy or change in practice and want to share your views publicly to encourage others to join the debate. At the same time, writing for publication can also raise your professional profile in your own field of practice. It can also boost your CV, enhance your job prospects, and aid your own professional development. Once you have decided you would like to write for publication, the next thing to consider is where you would like to publish your work. The most important thing here is to think about your target audience. Who are you writing for and what are you hoping that they will gain from reading your article? This may sound obvious, but sometimes your work can be relevant to more than one publication. For example, if you're a children's nurse working in cancer care who has carried out some research, you may think about publishing your article in Cancer Nursing Practice, Nursing Children and Young People, or Nursing Standard. Or, if you work in a community setting and have introduced some work that may benefit patients with learning disabilities, this could be relevant to primary health care or learning disability practice. But if you are at all unsure, please do give us a call because we are always happy to advise. Some journals, like Nursing Standard, reach a large number of nurses, while others are aimed at a smaller, more specialist audience. This is something you might like to consider when thinking about where to publish your work. It is important to approach one journal first, whichever you feel is the most relevant for your work. If the editor agrees, he or she will commission you to write a piece. If not, they may suggest an alternative journal that they feel is more appropriate for your work. The next thing to think about is what type of article you wish to write and which part of the journal this is most suited to. As well as clinical features, we also publish opinion articles and letters to the editor, which we encourage our readers to contribute to. Writing a letter to the editor can be a good introduction to writing for publication if you have never done so before. In terms of the length of articles, this varies. Our clinical features are up to 3,500 words in length, letters to the editor are up to 250 words in length, and our opinion articles, which express views on anything from changes in practice to government health policy, are up to 800 words long. Other videos in this series will give you advice and guidance on what to publish, how to structure your articles, the publication process, writing continuing professional development articles, and referencing. Before you put pen to paper, please do contact one of the editors or go onto the RCN Publishing website where you can access our author guidelines. We wish you every success with your writing.